Hey Vic, how's Aspen?
Hey, it's good. Reporting on location here from the Aspen Ideas Health. I think it's great. It's been raining though, which is not ideal for my trail hikes, but other than that, really good.
Yeah, well, I'm glad you're there. It's certainly an inspiring environment.
Yeah,
Just not even during ideas, just being there, being up in the mountains. It's beautiful.
yeah. The setting is great, and then the people that are here. I want to just talk about it at the end, but there's a lot of really talented people doing great things in healthcare. It's cool.
Yeah. Um, well, look, let's jump in because we've got a lot to cover, and we're going to talk about what you've seen so far in kind of a day and a half at Aspen Ideas Health. So let's dig in. All right. So, starting with a very, very quick segment on the economy, there's really nothing to talk about from a Fed perspective. We've already had our inflation numbers kind of roll out in previous weeks, and we've talked about all-time highs in the stock market. The big story this week is we have a new king of the hill. We have a new most valuable company in the world, and it is Nvidia.
Yeah, I mean, and we have a chart that just was really like jaw dropping to me, where how quickly Nvidia has grown from a really respectable, good technology company in the 500 million ish range to now over 3 trillion, and the growth has been just incredible.
The rise, and in this chart, they show the rise of Nvidia relative to Microsoft, Apple, and Amazon in the same period of time. It's kind of crazy how Amazon's being left behind quite a bit by Nvidia, Microsoft, and Apple. But Nvidia's rise it definitely is backing a lot of the conversations that we're hearing around AI being a bubble, right? Because I think if you talk to 100 people and you ask them, how much have they changed their lives with AI today? I think they would 99 would say very little, right?
Right.
And yet the rise of value creation of this company does not reflect that at all. You would think that the world is completely getting handed over
Yeah.
to AI based on how much value Nvidia has created over the last 2 years. So I do think that the bubble talk is warranted. It does feel a little dot-com boomy. Um, but at the same time, I think we all do believe that what we're seeing right now with AI has an inevitability to it, kind of in a way that maybe the pets.com era of the internet did not
Right.
have that same sense of inevitability. And so I think people are a little bit less, just less ready to jump on the, let's beat Nvidia up bandwagon. There's probably people bravely shorting them, but you're not hearing a ton of people talking publicly about shorting them.
Yeah. Yeah. I think that's exactly how I feel. I'm a big believer in AI is that it's going to change the way we do a lot of things in healthcare and in the world. But I think it's similar to the Cisco, you know, really significant growth in the late 90s related to the internet. And we needed to put in place the internet, which really was Cisco routers in large part. And they were by far the best. And we needed a vast number of them. But then we built out the internet, and there wasn't really use cases for using all that capacity. And I think there's something similar to this today, where we we need to build out the infrastructure for AI, which really are these large language models and the chips that are required to create this intelligent thing called a large language model. And there's a vast need for those right now. But then I think very similar to the internet, in my opinion, and I could be wrong, but I don't know that the the demand for using those models is yet built out behind that building out the highway maybe.
Right.
And so Cisco at least had kind of a fall because the internet, there was this trough of disillusionment where like, gosh, pets.com is really not much better. Um, and so all those use cases weren't, you started taking the old technology and trying to slap it on to a new whole thing. And I think we're doing the same thing with AI. We're trying to take like the way we do assessing deals in venture capital. We're trying to apply the old ways using AI and I don't know. It's interest. It's intellectually interesting. It's like the internet. It's interesting, but I haven't seen a ton of adoption yet. And Nvidia is the by far the best, and we have to give them credit. Just like Cisco, they're brilliant people, and they've made a lot of money. To their credit, they have seen this story with Cisco before too. So they're trying to move up the
Yeah.
stack, add
Yes.
software, and build it
Yes.
out. They're not blind to this, but that growth is going to be hard to sustain. I just don't see how it can be sustained. So
Yeah. It does seem that we're in a bit of an arms race, and there are applications, and I think a lot of those applications are probably we're about to talk about, some VC deals that landed this week. Certainly, a lot of VC money is pouring into AI. It seems like the
yeah,
majority of VC money right now is pouring into AI. So there is this belief, probably working from the back to the front, that we are going to replace a lot of sort of human-powered systems with artificial intelligence, especially where there's not going to be an outcry, right? I think
yeah,
the whole dock worker situation, is one where we can point to and we
yeah,
can say, see, this generates an outcry. But
yeah.
if you think
I
about
think the
things,
difference is in healthcare. Our workers are crying for help. They,
yeah, good point.
they're not worried about their job security, at least right now. They
Right.
need tools, they need assistance, they have too much work to do. So it's a little bit unique in that sense. There's not a lot of industries where that's the case, but healthcare certainly there's just not enough at any licensure level, all levels. It's really there's just a lot of patient demand right now.
Yeah, fair point. All right, let's go into our VC rundown. A company called Humata Health, secured 25 million for, guess what? AI powered prior auth. A couple things I think are interesting about this. First, the raise was co-led by Blue Venture Fund and LRV Health, with participation from Optum, 406 Ventures, High Market Ventures, and Venture for Good. So again, this is another one of those deals where the payers are kind of circling around it and all sort of throwing in, probably just trying to see, how it all pans out. But yet again, this is another one of those situations where no one loves prior auth. In some cases, they even found that just removing prior auth entirely, we saw this during the Change Healthcare thing, literally made no real difference. And so certainly at least removing the human cost out of it and sort of automating it down to something that is a lower level, machine learning activity makes a ton of sense. 25 million from some pretty noteworthy VCs.
Yeah, and I think part of the reasoning is that CMS is changing sort of what is allowed, and they talked about this in the story that I think you have to have a really fast turnaround if you're going to put a prior auth, kind of speed bump in place for all your patients to get this diagnostic image. That is allowable for the payer. That maybe that's your job at some level, but you have to respond within 24 hours or whatever the rule is. And I think part of the reason for this startup having the attention it has is a lot of the prior auth systems today would have to cut back the number or not screen as low kind of risk things and let more through. And so there's more technology that sort of help them. It's an arms race really, and then the providers are going to need to have tools to get more pushed through the system faster.
Moving on, Pomelo Care raised $46 million in Series B in an effort to improve pre and postnatal health with earlier interventions. So this is a virtual maternal care company who's in Andreessen Horowitz, First Round Capital, Box Group, Operator Partners, SV Angel. So this is a proper Silicon Valley, New York, Silicon Alley deal, and 46 million. That's a sizable chunk for VC.
And maternal health is like probably one of the hottest areas right now. And so it's in tune with the zeitgeist. It's what those kind of firms do. I think it's going to do well, I think.
I do think what's interesting though is it seems like there are some mixed stories about the viability of virtual services, right? I think we first sort of saw that when Optum had their layoff, and it was largely sort of focused in their virtual care segment. But even since then, I've heard of multiple virtual care, telehealth focused businesses really struggling. And I can't tell if that's a demand issue or if it's a reimbursement, rate issue
Well, so
or a market saturation issue.
Yeah, we may end up weaving some of the Aspen stuff through the discussion, because one of the big topics at this VC panel that I just attended was um, there is a dichotomy between the digital health solutions that often are venture backed, delivering really good outcomes on the per person, per patient basis,
Yep.
but not integrated into the traditional referral patterns. So, like, you don't get referred into, they were talking about musculoskeletal use case. So, you don't get referred to the General Catalyst on the panel. So, they have SWORD, which is the digital health rehab thing. And it has great results, but the incentives are not aligned. And the doc does not benefit from referring, even though they should, kind of morally and ethically they should. And so you get this disconnect, and there's a lot of discussion of how can we integrate these, because I think everyone thinks there's a combination that's needed. You need digital health, you need much more touch. Virtual is much more convenient for the patient and the doc,
Hmm.
but it's not the only solution. You also have to have in person, and a lot of the billing requires an in-person physician,
Yes.
and so uh, the bill of record, it has a lot of power in the negotiation, but they're not delivering all of the behavior change. So there's just like there's an industry disconnect there that is not solved right now.
Yeah, yeah, and it's certainly not clarified through CMS's current pathways. I mean, if anything, it's just complicated by that. So
Yeah, that's right.
yes, state lines, observing physician, et cetera, et cetera. It's just pretty complex. Circling back to Tempus AI, we talked about them probably 2 weeks ago with their IPO. Their IPO surged, so shares were priced at $37, and that was the high end of their target. They opened trading at $40, and they rose to nearly 44 before fading a little bit. So this is a company that's got backers such as Google that are in it. The ticker is TEM, and look, a successful healthcare AI IPO that actually sort of went out at 37 and is trading in the low 40s now.
Yeah, it's great. And we haven't had a lot of these over the past couple of years, so it's good to have one to celebrate.
Yeah, and it's also interesting that it's a company that is closely connected to Google, right? So we're seeing more and more of the Magnificent Seven getting involved in other companies, backing them, investing, partnering with, sharing data, sharing technology, and now we're starting to see some of these companies grow up in order to be publicly traded companies. So that's an interesting dynamic to the venture and PE landscape for sure. And then closing out things on the VC side, MIT has spun out a new venture fund called the Engine Ventures. It's a near $400 million fund, and it's focused on tackling tech's toughest problems. So problems in sustainability and climate, but also focusing on biotechnology. So all makes sense for MIT, the kind of technology and talent that they're going to have there. They really should be focused on the world's hardest problems. The quality of the science that's going to come out of there is, really kind of second to none. But spinning out a brand new fund with 400 million in fresh capital in the middle of the Boston VC ecosystem is likely to create a whole new sort of, swarm of deals coming out of MIT.
Yeah. And then hopefully new deal sources, diverse, they know different people. I think it's always beneficial to add early stage venture capital. And Boston, there's plenty of work in Boston, so it's good.
Yeah, no, Boston easily one of the strongest ecosystems in the country. So I think that's good news. All right, so now shifting into news about the Surgeon General. This may be something you could speak a little bit about from Aspen Health. Last year, the Surgeon General was there, sort of talking about this. I remember I was sharing this with you when I was there last year. But basically, now going full on and saying social media platforms should have a warning label. And there's probably no stronger way to communicate that a product is harmful than a Surgeon General's warning label on it, right? I mean,
Right.
What do you think about when you think about Surgeon General warning labels? You think about tobacco, right?
Yeah. I mean,
You
I
think about
remember when that happened, and it was
a big deal.
it's an important step in getting the public consciousness around to that.
Yeah.
Now,
So,
I think,
this is a really, really big, bold step.
yeah, yeah, I
Um,
don't think the government can do many more things that are symbolically bigger than this. Like
yeah.
the highest medical doctor in the U.S. government, I think is the Surgeon General.
Yes.
And he is saying that in his opinion, social media needs a warning label for kids. And I think that's pretty clear. And out here at Aspen, I think everyone is totally on board with this and thinks it's overdue. So there's not a lot of debate around this topic at Aspen other than everyone like saying it should have happened earlier. There's more discussion around the election and like what will happen versus one administration or the other.
Right.
But I think there's broad agreement on both sides of the aisle, but certainly here in Aspen that social media, adults certainly have every right to do whatever they want to do, and they can smoke cigarettes and do lots of things that kids can't do. I've been saying this for a long. You and I have talked about this on the podcast before. How we regulate it is a different thing, but I think it's a great symbolism for the country.
Yeah, I mean, it does seem like both political parties like leveraging social media for their own, propaganda, marketing, messaging, campaigning. But they also has been pretty clear bipartisan alignment by attorneys general across the country that social media is harmful to children, right? And you can see why on both sides of the aisle they would sort of take issue with it, right? I mean, you have the Republicans with the religious fundamentalism, and obviously, like, there's a lot of sort of sexual exploitation. There's a lot of non-binary exposure, things like that, right? So these are all things that the right would sort of take issue with, right? And then I think on the left is probably a lot more about like the damage being done to young girls, right? Sort of the impact to young women, the body shaming, the bullying, the perfection comparison syndromes that are happening on that side.
Yeah, it's terrible. And I think I'm reading a book right now about the effect of boys. I mean, it's difficult in different ways for the sexes, but I think it's difficult for all of our children.
Yeah. So look, it's interesting. It's possible that the Surgeon General thing might stick, regardless of what administration is really in there. It could stick, which would be really interesting.
Yes, I think it should.
Which would be really interesting because we had this era where all the tech companies tried to sort of do a social media. I remember living through that back in like the back half of the 2000s, and then it really has just sort of come down to it's Meta, right? I mean, TikTok, we don't really need to talk about them because they're a Chinese company still, right? So we don't need to talk about them. They have different issues, but
Meta
Google
is the huge 800-pound gorilla. I mean, X is kicking around, but who knows what they're doing? So
they're
Meta
super small. They're not publicly traded. They're just like a fringe thing. They're popular in DC, but it's very fringe. And quite frankly, like Elon just said, hey, we're going to let porn run wild on X. So I think they would very, very quickly become like an 18 and up kind of platform. That would just kind of happen.
And
they're
small. I mean, for this discussion, they're small.
That's exactly right. But for Meta, Meta is a completely different thing. Meta's whole business is this, and you could see like it would kind of cast Meta as a vice company, like Meta and Philip Morris are in the same business.
I mean, Meta is a vice company.
Yeah, but they don't say that they're a vice company. They say they're a company that brings the world together.
But that's not what they do. That's not how they make money. Just like Philip Morris does lots of good work in schools somewhere, they sell cigarettes. And Meta sells attention to people that want to sell you something. And that's what they do. And there's nothing wrong with that. But I own Meta stock, but that doesn't mean I don't think they're a vice company. So labeling social media as a vice and as, potentially harmful to children, I think is pretty clear. Now, how we regulate it is a different thing. But at least parents know that they should be cautious in how they work with their kids around this stuff.
Following the story of the Surgeon General, there's a story in the Wall Street Journal, basically, kind of investigative reporting that says that Instagram is recommending sexual videos to accounts for 13-year-olds. And they've got tests that demonstrate this. Obviously, Meta is denying this. these kinds of studies, I think, are going to be undeniable. Anyone who has experienced Instagram knows they're true,
Yeah.
right? And it's not even clear that Meta has that much control over it, right? Because
Well, yeah, I mean, I disagree with that.
let me finish what I'm saying. Because all a young person has to do is lie about their birthday.
Yeah.
That's what I mean. As long as they don't have real age verification.
So that's enforcement. I would call that enforcement. But this story is not about that. This story is, I think, a reporter created a new profile, said they were whatever the age is at 13. I haven't pulled up. And within 20 minutes, so it didn't take long. Within 20 minutes, it was serving them sexually provocative information. Now, do I think that 13-year-old boys will be interested in that kind of material? Yes.
Of course.
But I think it is within Meta's control to say we're not going to, you have to lie about your age if you're going to see this stuff. Now, if someone lies, that's a different thing. And I'm not sure that Meta can, it would be hard to police that. But that's not what this story is. They don't even have those basic guardrails up now. And that seems, it at least seems like a PR mistake by Meta, because it's bad PR.
I mean, I'm not a Meta fan, so
I mean, I use Instagram. I mean, I'm not opposed to Meta, but I do a lot of things that I wouldn't necessarily want my 13-year-old to do without any guidance. So I'm not saying that adults can't use it or that's not a good service. I think the Surgeon General's right.
there are things that Meta does that are helpful, but the truth is they have the entire market there. So you're kind of trapped. It's like if you want to be able to interact with your friends, with other people, you want to know what's going on, you want to market your business, like you can't not be on there. I mean, you can choose to opt out and you can choose to not be on there, but that comes at a cost. That comes at the cost of not being able to, target to the billions of people that they have on there for your business. That comes at the cost of, not being able to have conversations about things that your, social group thinks are relevant. That comes at the cost of potentially not being able to, stay up to date on what's happening with friends and family. So it's like they've got such lock-in with societal lock-in, that, yeah, you're getting something good out of it. But I would say on net, it's a negative at this point. I would say on net, the stuff that is pumping into your head, the time that is stealing from you, the data that is capturing from you, the way that it's manipulating you with what it is constantly suggesting.
You're talking about even for adults. Even for adults.
I'm talking for people, period.
Yeah. Yes.
Right. I mean, obviously we have issues with what it's doing to children because they're they don't have a chance yet. They're children, but it ain't helpful for adults either. I
mean, we're coming back to it. It's a vice, right? Like cigarettes are available in every gas station, and as a society, we do our best to keep kids from buying them. Now, do kids get cigarettes? Yes, of course they get cigarettes, but it's not legal for them to get it. So it just at least creates. You have to really be trying.
Right.
And a lot of kids, I did when I was a kid, but it's not that it's impossible, but I think that's, if you're a vice like that and you're not bringing people together in harmony and holding hands, which I know they say, but is not actually what they make money at.
Mm-hmm.
I'm not saying that it's not a vice that adults should stay away from, but I think the Surgeon General is saying that we need to do more to protect our kids from this vice because it's addictive. I mean, I think it is clearly addictive to me, and addictive things to children that they might be addicted to for a long time is not a good thing for any of us.
Staying on the topic of addiction, executives from Dun Global, an ADHD startup, have been arrested and charged with fraud because they have orchestrated a scheme to profit from Adderall prescriptions. If you know people with ADHD, you may have heard them talking about, fear of shortages of Adderall. that a lot of college students have been taking Adderall to perform better in school, to feel like they can, focus and study and nail their tests and stuff like that, not necessarily needing it because they are actually, diagnosable ADHD patients. And a lot of these online telehealth things end up becoming pill mills because they can, because the barriers are really, really low. And this is another case. It's not the first one. I think what was it? Cerebral was the last one that was very, very similar to this. So now we have another story. Done Global. The founders have been arrested.
I mean, this is a topic out here. The access to care is what we really are trying to promote. Like, if you need ADHD medicine, and you have a condition that you're suffering from, we should get you the medicine. And so we try to open up telemedicine and ways to get it out there more to more people, but that opens up the possibility for bad actors, which clearly these people are.
So. Yeah. So, I mean, hopefully we're kind of done with this entire space. Interestingly, this story does cite that Dunn's early investors include David Sachs. So, there's the other side of being sort of one of the biggest podcasts in the world is, every investment that you make is going to be highlighted. And, I wouldn't say the all-in guys have a great track record on the healthcare side of things.
Yes, that's right. Healthcare is hard.
Yeah, they should probably just stick to AI. Okay, continuing on. Private equity execs are currently deep in the crosshairs, especially in Massachusetts, where the whole closure of hospitals due to the Steward Healthcare bankruptcy occurred. And now there's a Senate bill that is threatening to jail private equity execs for looting healthcare companies and basically creating gaps in care for communities. And no surprise, Senator Elizabeth Warren is front and center on this bill. The act is called the Corporate Crimes Against Healthcare Act, and it was introduced on June 11th by Senator Warren as well as Senator Markey from Massachusetts.
Listen, they have people in their state that are really harmed by the Steward thing, and it's good politics, right? But this is not going to be a law. This is them expressing how mad they are at private equity. But it's a big topic out here at Aspen. There's a huge question about, should we subject healthcare in our society to for-profit minded private equity people who, by their statements, they are out to make a profit. And then the best ones will also add in, they want to improve the results for patients, but that's either equal or secondary depending on which firm you're talking about.
Yeah.
And I think there's going to be a lot of discussion. Private equity is certainly being questioned, and there's going to be more press like this, but I don't think this bill is real. I think but there is a trend up until the election, I think, of going to be lots of talking points about how it's an easy image to paint, a wealthy private equity guy jumping on his private plane, doing bad things to local people. I don't know how real that is, but it's certainly a storyline.
Just to pull a quote from this modern healthcare story, talking about sort of the focus of the bill, it says here that executives, and then in quotes, whose actions contributed to a triggering event that results in the death of or injury of a patient or patients, end quote, will face up to 6 years in prison.
There are a bunch of executives at Ascension. People die in healthcare all the time.
That's what's so crazy. That's what's so crazy about that, right?
That's not the standard, right? So.
Yes, that's the point. You're going to leave it up to a court to draw a line between an executive's actions being a triggering of an event that results in the injury or death of a patient. That's a lot of stuff to have to connect.
Let's take the Steward example, right? Like 3 years ago, they sold several real estate assets for cash and then lease the buildings back as a corporate balance sheet strategy for their own purposes.
Hmm.
Several years later, that was not a wise decision. Interest rates went up and lots of things happened, and there's a lot of patients that have suffered. It's really difficult to go back and say that you can prove that that decision led to that. I mean, with hindsight, you can, but at the moment, it would have been hard to know that, I think.
Yeah. Yeah.
I'm not saying they were good actors. I don't think necessarily everyone involved was a good actor, but even that bad case scenario is a hard fact pattern for this bill.
Yeah, I think you and I both agree that the bill is largely a way for Massachusetts senators to show their constituents that they understand the severity of the situation that is Steward Health, and that
And
they
we're
are.
trying to do something.
Yes, yes. They're definitely signaling we are willing to spend political capital to work to affect change here, and we believe that these private equity people, if they do actually cause a death, should go to jail. That like so, they're sending us in a certain direction. But I think the
Yeah.
bigger thing here, there's really kind of 2 points, and we've talked about this over I don't know how many shows now, but one, the Steward Health event is a tipping point for private equity. And it's going to be a flashpoint, and it won't go away. And now that Elizabeth Warren is off the crypto thing, this is something for her to sink her teeth into.
Right, yeah.
And then, the second thing is private equity is in the crosshairs for a lot of reasons, right? And it gets lumped in as an entire industry when really we're talking about a subset of the industry that are bad actors. You could say the same thing about telehealth, right? I mean, like, is everybody in
Yeah.
telehealth a pill mill? Like
Right.
done global and cerebral? No, of course
Right.
not, right?
Right.
But you get enough
Yeah,
bad
should we
stories.
never have telehealth because there are going to be few bad actors? No, because
That's
the
right.
access to care is, from a population point of view, much better than the bad actors.
That's right. But unfortunately, in a K-shaped economy, no one feels bad for private equity.
Right. Exactly.
Right. So I think it will be interesting to see how, again, this is another one of those stories that feels like it will be, the outcome of it will be very dependent on the election in November.
Yeah, I agree.
Humana finds that value-based care leads to fewer hospital admissions for kidney patients. Obviously, that's a great story. We have been hearing about the growth of value-based care in the kidney space. We know several companies that are growing quite a bit in value-based care in the kidney space. There's been a lot of discussion around how that impacts the future of DaVita and other, Fresenius and the other big dialysis companies. But what's sort of your take on this? Obviously, Humana, very focused on near end of life because they're a Medicare Advantage company.
Yeah, well, Humana is a Medicare Advantage company, but the reason I like this is it's a 5-year study.
Mm-hmm.
So these are patients that Humana had in 2019, and they've followed them for 5 years under this program. And so I haven't seen a lot of longitudinal studies at that length that were really positive. And so they had very strong patient outcomes where they reduced the risk of ED visits and all of the follow-on bad complications with kidney disease. They were able to not prevent but mitigate, sort of make slightly better. But over a 5-year period of time, that had good results across the whole population, and it costs less, and the patients had a much better length of life and quality of life.
Yeah, I mean, look, here are two key data points. One, they say patients in value-based arrangements experience 5% fewer unnecessary hospital admissions than their fee-for-service counterparts. That's substantial. And then probably even bigger from a cost perspective, since value-based care engagement has increased since 2019 among members with CKD, the company's medical expense ratio for this group has dropped more than 12%.
Right. And that combination is what's incredible. I mean, it's 5 years.
Right.
This is not a tiny study over a small period of time. And it's no matter who you are. If you care about patient outcomes, it's great. If you care about costs, it's great. They seem like it really, I don't know, it's a well-run study, and it seemed to have great results.
Yeah, so we will put a link to the actual brief in the show notes. It's a issue brief called Value-Based Care and Nephrology, if you care to dive any deeper. Okay, going back to our story about the rebirth of the new wave of payers. Here's a name that we hadn't heard in, I don't know, for me, I feel like I haven't heard in 6, 7 years. Decent Health. So this was one of the new payers to come on the scene alongside of the Brights and the Oscars and the Clovers, et cetera, et cetera. I did not know this about them. I just saw them kind of fall off the face of the earth. But they were forced to lay off 94% of their team. We had Decent Health at Health Further. Did you know that?
Oh, really? No, I did not
Yeah.
know that.
Yeah.
Yeah.
Yeah. So anyway, they're back.
Yeah.
They're back.
Yeah, so
They're up and running.
they had payer relations, like a lot of these tech forward payers. They didn't start with nationwide coverage, so they had like a relationship with a payer, I think, to get that full service, which they lost. So like at one moment in time, they lost their ability to deliver the service. So really struggled. They laid off almost the whole team, and now they have kind of re-emerged as a partner, really primarily focused on employers mostly.
Yeah, look,
I think it's healthy, like new ideas, new startups doing new things in payer markets is good for all the payers. It's going to force them to, get better, and maybe some of them will grow and will have more choice.
I think it's also helpful for people who are not like actually in the startup space to know like this happens all the time. These startups just never die. I mean they do, but a lot of them don't. A lot of them just like hang in there. 94% staff layoff, and then like you're still doing it. It's just, startup founders are just insane.
That's the number one predictor of success. Is like, are the two founders or three founders, do they have enough like stupidity and grit and passion mixed up where they're going to just keep going, even though there's going to be a lot of bad times. So, but when they actually turn, I like to note it because there's so many times when it doesn't turn too.
Yeah, for sure. But you know what? It can't turn if you quit.
Yeah, that's right.
So that's that's kind of the value of sticking at it. So, okay. We've one thing's been interesting about the whole Ascension story is just the incredible transparency that we've had sort of consistently throughout this process, certainly from Ascension corporate. Yeah. There's no question. They've been very, very transparent. But I think also we've seen a variety of different news stories, and this one's on NPR. I feel like several of them have been on NPR where they're
NPR
interviewing.
Been really paying attention to it. Yeah,
NPR has been really paying attention to this, and they have now had several stories where they've been interviewing Ascension clinicians, and right. It's unclear to me whether or not this is quote unquote cleared by Ascension, PR or what. But I actually think it bodes well for Ascension that their clinicians are able to sort of say the truth of, hey, this is the actual impact to our ability to take care of our community when this happens. It's not necessarily, you could say maybe you didn't protect yourself, but I think the track record so far of hospitals to protect themselves from cybersecurity incidents that shut down their EMRs is very poor. So it's kind of more par for the course at this point until we have some broader regulatory
you talk
changes.
About some of the hard things in the story, but I agree. Being transparent and really I think essentially just being a leader in this whole issue of here's what we did when we got attacked. Here were the repercussions. Here's the good and bad. Very open, because there's a lot of smaller health systems that don't have the resources, don't have the depth of management teams, and they can sort of try to follow that. And part of being a leader is allowing some of the hard and sad truths to let your clinicians I don't know that it's been approved by the public relations teams, but it seems like they're clearly not reprimanding or disallowing people from speaking freely, which I think is good for the overall industry. We need to talk about this stuff so that we're all aware of it.
Yeah. So in this story, in this NPR story, there's a part where one of the Michigan Ascension hospitals, a nurse says that a woman had low blood sugar, and in quotes, an altered mental status. She went into cardiac arrest and she died because the staff waited 4 hours for lab results that they needed to determine how to treat her, but they never received them, right? And one thing I think about is there have been many times where I've taken my parents to their doctor in the Vanderbilt system, right? And I've got their app on my phone, especially for my dad. He doesn't, he can't log into anything. So
Yeah.
I've got the app on my phone, and he'll go back to take the lab, and like before we leave the building, I get a
You
notification.
you have the results. Yeah.
Yeah,
Yeah.
I get a notification with the results, like before we leave the building, right?
Yeah.
Because that's how all these systems are wired. They're wired
Right.
for communication via the EMR, right? And it's
Yeah.
like when the
And
EMR
there's
is down,
right. And they enable just much better care because of all that technology. And then I think it's not surprising that when you take all of those tools away, people die that we could have saved if we had the full suite of technology. That I think that is sad, but it's not surprising. That just is. I mean, the benefit of the technology is it saves lives. When you take that tool away for an extended period of time, you can't save those lives.
yeah, it's a story that confirms what we all intuitively know, which
Right.
is, we have digitized our health system to great positive effect. Now that hospitals are the number one target for cybersecurity attacks, um, that that upside has a downside in that even though we may train for how to continue to operate when we have one of these incidents, it's certainly going to be to a lesser effect. It's certainly going to be to lower quality. It's certainly going to lead to more deaths. That's just what you have to expect, right?
Yeah.
Is going
So
to
I
be
mean,
the result of it.
Think about it this way. EMRs were mandated in maybe 2019. I mean, 2009,
Yeah,
2010.
2009. Yeah.
So for 14 years, 15 years, every doctor that entered practice, they don't know anything else. Like they came into, so you could have a 35, 40-year-old doctor who has never practiced on paper because why would they? And then we immediately go back to like 1990 and they're using physical files. They're printing out the entire patient record and like passing it around. And one, it's not as good, and two, none of the doctors or nurses or lab tech, no one has any experience working in that environment.
Right. Yeah. So anyway, heartbreaking stuff, and I think really just punctuates why, as a country, we've got to figure out how we're going to deal with protecting our hospitals, right, from these cybersecurity attacks. We've got to figure out, is it going to be strengthening our vectors of attack? Is it going to be redundancy? Like what's it going to be that's going to allow us to be more resilient? Because it's not just money. There's lives on the line, right? There's lives on the line.
Yeah, and
Um,
it's a complex problem, but we need to keep talking about it, I think.
Yeah, for sure. And the transparency helps us to do that. So again, salute to Ascension for the way that they've been handling this situation. Amazon Pharmacy expands RX Pass subscription service to Medicare patients. And look, when this came out, I asked you whether or not you thought it had anything to do with the recent turnabout in terms of CMS with their changes with Medicare, because there were impacts to Plan B, with Medicare, and I
Yeah,
don't know if this kind of was a green light once they saw CMS bow face to say, hey, we're going to open this up to the Medicare population.
yeah, it might be that. We talked about that an hour ago. I don't know if it is or not. How I read it was Amazon sort of opening up a sort of a really emotionally friendly avenue to get to seniors to start using Amazon more and sell them these drugs, probably at very low margin, no margin. I think it's
Hmm.
like a $5 a month kind of
Yeah,
package
five
for.
dollars a month.
Um, but then you're in there all the time managing your medications, and you end up buying a bunch of other stuff too. Um, Combined with Amazon is, by the government being attacked for bad practices, so getting positive senior approval might also be good. That's kind of, it may be related to CMS, but I was thinking it was more of a market strategy. Amazon just keeps beating at healthcare, trying to take um, different approaches, and I think they're going to keep trying that until they find a way in and start making money. Um, they will not continue it. They'll do it for 2 years and then it will go forward or it won't. But that's kind of how I thought about it.
And just as a reminder to listeners, the RX Pass program launched in January 2023 provides unlimited access to 60 eligible generic medications. They'll ship them to customers' homes for a flat fee of $5 a month, and you have 24/7 access to a pharmacist. So it's a pretty compelling package. All right, I think you mentioned that caregiving has been a pretty important theme at Aspen Ideas Health. Wall Street Journal has a story. Headline is "When Caring for Your Parents Comes at a Cost to Your Career." It's another one of these interest stories around caregiving and the real life impacts of caregiving. What to even say here? It's been my lived experience, except for I'm getting kind of the best version of it because we have resources financially and also resources in terms of the right network to be able to
Right.
bring in great home aides, to be able to bring in a care management organization with nurses and occupational therapists and access to nutritionists and all that kind of stuff. But gosh, if I didn't have those resources, um, you know, there's no way this would not be impairing my job. And oh, by the way, um, not having those resources also probably means you have much thinner margins in terms of time you can actually stay away from your job without it impacting your job, right?
Yeah.
Impacting your security of your career. So, it's kind of like the more you have, the more you have, and the less you have, the more damaging this can be.
Yeah. I mean, we've talked about this. It's a big topic here at Aspen Health and Ideas. And I think the striking thing in the story was the number 29 million people. I mean, you have a job where you can be virtually in meetings and still be very impactful.
Yes.
They interviewed a woman who she has a good job. She runs a lab at the University of Oklahoma for students to do research. And, she seems successful. This isn't like a fast food worker, although they have real issues too. Um, but her students need her in the lab, kind of helping, knowing what to order, how to do something, and
Yeah.
she couldn't do her job, and she was able to work with the school and rearrange her schedule. But there are jobs where you have to be present. It's a retail job where you're managing people, and the story is really like there's a whole lot of people, 29 million, that they can't do the job that they're used to doing and take care of their parents or their sick family members. So, and then out here at Aspen, it's really a challenge that fits well with the Aspen ethos of like really huge, complex problems. It
Yeah.
seems like it's what people at Aspen are looking to sink their teeth into. And so the demographics around the boomers aging combined with the workers largely retiring early or deciding they don't want to do the hands-on healthcare, the really hard home care, maybe like autism care or other cares that are difficult and stressful and hard, even physically hard. So we need many more caregivers, both at the doctor level, the nurse or tech level, at the home health level. And then there's some policy things that I've learned about here that really are frustrating. I didn't know this, but in 1997, Congress froze the number of residencies that medical students can take part in to
Oh,
learn their
wow.
specialty. It was frozen in place in 1997 for budget reasons. Medicare funds all of those residencies. And the government was frustrated that other payers were not chipping in. And so they said, well, we're just going to freeze this now. And we'll come back to it in a year. And it's been since 97.
Wow.
And so we haven't grown the number of residencies. We have many more. We have a surplus of graduating MDs
Almost 30 years.
that they can't practice. So they end up going to biotech, or they go into the insurance industry, or they do something different, but we could use them. And then all the way down the stack, that's at the highest level, but every level we have just a bad shortage, the big demand and a bad shortage. So I don't think there are really good solutions now, but it's a public policy issue. It's an industry issue. It's kind of everywhere.
Yeah, look, this story will just keep coming up, and unfortunately, more people are going to be touched by it. It does seem like it is the time for our generation to really start to come into acceptance of it, and we're really not even at the boomers yet. We're dealing with the silent generation,
right?
The
Boomers
now,
are still walking around playing golf. They're not really.
I know.
When they clip over 80, it's going to start getting hard.
It's going to get hard. It's going to get hard. All right, final story, and then I'd love to just hear kind of a rundown from you about Aspen Ideas Health. But closing out on the AI side of things, OpenAI expands their healthcare push with Color Health's Cancer Copilot. So immediately, what jumps out to me about this headline from the Wall Street Journal is use of the word Copilot. When we had Ambar Bhattacharya on the show, he signaled to us that there's going to be more and more growth and sort of clinical decision support. And that the term Copilot is a very acceptable term. Autopilot, not so acceptable. And so I think here we have an example of that, right, where OpenAI is sort of working with a startup, actually, Color Health, on a cancer Copilot that's going to help clinicians and patients sort of navigate what the right next option for them is. And this is being powered by GPT 4.0.
Yeah, and so it's probably the best use case to pick, in my opinion. So it makes sense that they would kind of start here and throw their marketing half behind this. And the reason is because it's a cancer treatment it's very complicated and personalized to each patient. And the number of options, there's lots of research, lots of clinical trials. The number of options is growing every day. And so that care journey, that navigation, it's a lot of work for the physicians, and having a tool as their co-pilot, I think, could be really impactful. So that's the good side. I'm excited about it, but I think when we shift into the Aspen stuff, there's a lot of talk around AI here. When you leave the revenue cycle, not touching patient data, and when you go into holding and providing assistance around patient diagnostics and patient advice, there's a pretty clear line out here that people have been debating. But before we jump into that, are there other aspects of this topic we should talk about? And OpenAI is going to keep growing like this.
No, I mean, look, I think it's it reinforces several stories we've covered in the past around, yes, there are very specific LLMs designed for medical use cases, but ChatGPT often is, right there amongst the best of them without needing to specialize. And there seems to be an argument, or at least a strong school of thought, that LLMs do better when they generalize than when they specialize. And so I think it's interesting to see, OpenAI stepping forward into this partnership role with startups. I think that's another thing. Right now you've got clearly this is not just like hey, startup bought some points with OpenAI, because you got the chief operating officer talking about the partnership, right? So how much more will OpenAI lean in a direct, sort of partner capacity, and not just hey, leverage our technology? That's going to be interesting. I think a lot of startups are going to be looking and saying, hey, should I be using OpenAI if they are picking winners? So there's just a lot of dynamics to this story, right? That are going to play out over time.
Yeah, and I think OpenAI is, what I love about them and what scares me about them is they are just like a ready, shoot, aim. They just are going.
Totally.
They will figure it out along the journey, and that has a lot of people nervous about AGI, and I think it will have some people nervous about healthcare. But I don't think the OpenAI game plan is going to change. So they're just going to. That's what they're going to do.
Yeah. And word on the street is Sam Altman is looking to figure out how to get out of this whole nonprofit thing and just turn OpenAI into a for-profit.
Yeah, he needs to. I mean, he's behaving like a for-profit, so he might as well.
Okay. Before we shut this thing down, man, what is going on at Aspen Ideas Health?
Yeah, so there's probably two big themes. We already touched on one, which is the caregiver crisis. And one of the things that I like about the Aspen experience, this is the first time I've been here, but it's really a global, it's a global attendee base. And there's people from all over the world. And there's a lot of good ideas from other countries too. And so really around this caregiving topic, they were talking about the mayor of Bogota in Colombia. It's Mayor Claudia Lopez.
Okay.
They have a significant. They're a little ahead of us, I guess. Their population is a little slightly older, and so she's the mayor of the city. She runs that city, but she coordinated caregiving centers where you bring your loved one, and it's like a daycare kind of experience for them, but high touch, real good quality. She kind of focused all of because it's state paid for. She took all of the caregiver services and centralized them in like 10 different hubs.
Okay.
But then they have services for the caregiver, so you can we can work out. You get your laundry done. You can get a massage. You get your like self-care, your educational classes, ways to improve your career. So that it's she got efficiencies from sort of consolidating the different sites of care, but also she's like recognizing the role of the caregiver, and it's had great results. So I think it's interesting to see what other places are doing. And then Washington has the first ever long-term care benefit for, I think it's 3 times the Medicaid level.
Washington State.
Washington State. So the state of Washington is trying to solve this long-term care issue. We can't afford as a society largely, unless you have long-term care insurance, and even if you do, it often doesn't have enough coverage.
Yeah.
It's a big issue. And so the Aspen ethos I think makes sense. If you have a problem where the entire society hasn't planned for retirement, okay, maybe people made bad choices, but when 300 million people have the same problem, it's still like a government issue.
Yeah.
Which is partially because a lot of government policy people at Aspen, but I think it's also true. Like if everyone has it, it's not just like a few people didn't invest wisely. It's a whole issue. So that those are just like early bright points maybe, but it seems like people are really focusing on this. And then the VC VC panel was really good. We had Dina Skakar, I think is how you
Lux
say it.
Capital.
And then Naveed.
Farzad.
Yeah, Farzad. He was good. And then Holly Maloney from General Catalyst.
Okay.
They all invest like cross stage, so from startup to private equity. And they all invest across like deep science, life science, payer provider, except for Frisk Cressy, which only does doesn't do life sciences, only payer providers.
Right.
But all really impressive. I know Navid, but they had a long talk about AI. It's really interesting that they sort of took this opinion that it's going to be used in the back office, not touching patient data, but that there's not the appropriate trust in place for any large scale adoption anytime you need patient data.
Right. I
understand why that is very touchy, but it's not my opinion that that's where the market is right now. So that's interesting, just because they are, of course, they're on stage telling a lot of people about it.
Yeah.
But I think, like we just talked about with OpenAI and Color, that
Yeah.
there's going to be people that have health data on AI systems. The industry, I think, needs to try to start thinking about, well, what do we mean by trust? Because if we don't come out and say what we want, that the technologists are just going to decide and it'll be gone. And then they spend a lot of time at this intersection of trying to get an incentive line between digital health, which probably is really much better at behavior change and engaging the patient and sort of understanding that to change behavior, it's probably many small steps over like a 6-month period. But the physician of record and the traditional networks are not integrated into that in any way that's aligned.
Yep.
And that's a real issue. There aren't examples where that's been done well. And then General Clados was asked directly about their health system purchase, which was great. So she talked about sort of why they decided to buy a health system.
Okay.
And they set up, and like you and I've tried to do this a lot. They set up a partnership with 28 health systems.
Yeah.
26 in the US and 2 globally.
Yeah.
And tried to get them. They mapped out like the transformational process, 7 steps, and no one would take the steps. And so they have more money than I have. So they bought this health system in Akron. Now, she said multiple times it's not closed, and we don't know
It's
if
not
it's
closed. And they don't know if it's going to close. Yeah.
Yeah. So
they have issues with the AG right now out there.
Right. Exactly. So, but I think it was very bold and impressive, and I'm excited to see kind of what they can do with a system. With one of their requirements, which was interesting, they would not have bought a system if you didn't have a payer and a provider attached. So
okay. Interesting.
Akron has a small payer, but it has the payer claims adjudication infrastructure.
Interesting. Smart.
And that kind of aligns with where I think, it's smart. Yeah, you have much more freedom of movement if you have both sides like that. I hope it would be really interesting kind of test case to watch if they can get it accomplished.
Yeah. First, they got to get the deal done. Then they got to go through M&A because they're going to do a leadership change.
Right.
And then they got to go through systems implementation. I mean, it's a 4-year thing, right? It's a 4 to 5 year thing, right? I mean, it's not. It's long term. But I'm with you. I'm very pro people trying things, right? I'm all for it. So I think that's cool. I mean, one of the things I've been thinking about, Vic, is that we've got to stop making generalized statements around like what's going to happen in healthcare and what's not going to happen. We got to start talking about specific markets, right? We got to start talking about socioeconomics. We got to start talking about demographics. We got to start talking about, what kind of payer category are we talking about here? Because healthcare in America is just, it's not, you can't talk about it this way anymore, right?
Yeah. I mean, I don't have it fully formed, but one of the things I like to come to these events is they just kind of spark curiosity about stuff that then I need to go look into more. But over the last 2 days, I've been thinking that, and the digital health versus traditional really kind of brought it home to me. We almost have 2 different healthcare systems. We have the boomer healthcare system that is, they're going to use technology to make it marginally better, incrementally better. But they like the care that they know about, and they already have the chronic disease they have, and we need to take care of them.
Yeah, right.
And then there's the millennial system that's all of the digital health stuff. Now, the millennials is not a big part of spending. So it's interesting, like the big spend is in the old economy and older patient population.
Yes.
But all the technology adoption is in this new market. We really have 2 different markets that we try to conflate together. And I don't think now the interface between the 2 is not strong enough now. That's part of the issue.
Well, here's the thing. I don't think people want to. if you're in the millennial system, you're in it to avoid the boomer system.
Right.
So I'm not sure that an interface
and the boomers need, maybe they can use sword rehab, but it needs to be, there's a different version for them, right? Or it's not as tech forward somehow. So I'm starting to get this thesis that there's really two different markets. And so if we do an investment or we're doing I want to know, okay, which side are we selling to primarily? And one is pretty exciting, but kind of small. And it's more about wellness and having babies. And they're younger. The millennials are younger. They're not a lot of late stage renal disease because you haven't got there yet. And in the older folks, it's a much bigger market, but they're slower adopters of technology. They're not going to adopt all the same stuff.
Yeah, and then look, I think the third market that you got to talk about is the Medicaid market.
Yeah.
So that's just that's its own thing too, right?
So I got to be careful. Well, I don't need to be careful. I met this woman from HHS last night, and we spent like an hour together. We went to a couple different events, and she was great. She's in the political class at HHS. So I didn't know this, but there's 3,200 people that work there, and about 200-ish get brought in by the administration. And so she was at the White House for a couple of years under Biden, and then she went over to the political class.
Mm-hmm.
And she was talking about this Medicaid change in reimbursement rates, which I am excited about. So I was asking all about, and it's really interesting. She was saying that they do all kinds of things, but this is an initiative they're kind of hoping to keep quiet. There hasn't been a lot of fanfare around it because they're hopeful that it can just be like put into the system. And of course, if Biden wins, then they'll keep working on it. If not,
Sure.
I just hope it's like no one really notices, and the Trump administration is working on other things that are higher profile. And so that like bureaucratic or political, trying to put in something that could have an impact like that, like that can really change the amount of money that goes into Medicaid in a way that lasts for a long time.
Yeah.
But they're trying to do it in a low profile way there's having a lot of press about it. And they don't think there'll be a lot of updating the payer contracts because they're not really like pushing it that much this year because they're just trying to like keep it under the radar. So just the whole policy stuff, I just have not paid attention to that much more, but that they're playing three-dimensional chess that is kind of interesting to hear about.
Oh yeah, listen, I mean the whole supplemental payments thing. I mean that's a sea change, right? It's like a massive thing, but it's so wonky that well, that's what I said. How do you get political points for that? How do you get political points for explaining supplemental payments? The round trip of the dollar going from the state to DC back to the hospital. I mean, it's too hard to really wrap your head around.
Well, I said to her, why are you not promoting this? It's like the biggest event in the last 10 years. And she said, well, one, no one will understand. And when they do understand, they're going to hate it. So why do I want to let the Republicans in on that? So
it's amazing. Awesome, man. And anything else? I mean, that's a pretty good rundown.
Yeah. I mean, there's lots of little stories. I met a ton of people, but I think that's a good summary.
Well, I'm psyched for you. I'm glad you're out there. I'm glad you're meeting people. You think you're going to be able to snag any guest interviews while you're out there?
Yeah. I have one around longevity that I think she'll be on. Longevity is kind of interesting. I don't know enough about it, but so I think that. And then there's a behavioral health woman I was talking to. I don't know if she wants to do it or not, but I'm working on it.
Okay, good. Well, man, have a great time out there. Thanks for leaving the conference and jumping in the hotel room to do the show, and you should get back to it.
And next week you're out. I have a guest host. I'm going to keep it. I have a secret guest host, but he's going to be great.
Okay. Can't wait to hear it, man. All right. Thanks so much.